Hello,
How you
hello.
doing?
Good. How are you? I was very keen this morning.
Like you're the first one that popped up, and I was like, "Oh, that usually doesn't happen."
No, it doesn't usually happen, but I'm ready to go. So,
How
but
you
we can
doing?
wait. We can wait a minute or two until more people jump on if
I'll
you
be
want.
most. I'd say about 99.9% of our viewers come after the fact.
Ah,
Yeah, like
so
all
they
the
watch the video that you
correct.
post
Yeah.
after.
So
Interesting.
on average, ours gets about probably about 10,000 views, like on Instagram stories, and Facebook. So just in
Oh.
case anybody's the 12 are watching right now that want to watch the whole 30 minutes, they can go back. Anyways. So,
Awesome. Awesome.
yeah. So I saw you got your second shot. How did you
I
feel the next day?
did. Uh, Mostly okay. The first and the second, I had a really sore arm, and it really just feels like somebody was like pummeling my arm for 2 days. And so, it's hard to lift and, yeah.
But
So
no
that
headache or
was,
anything?
I had a little bit of, when you just kind of feel a bit clammy. I know that sounds gross, but you just
Okay.
kind of feel kind
Yeah.
of off a little. Yeah.
Hangover? Are you talking hangover-ish?
Oh no, hangover is much worse.
Okay. All right.
Thankfully, it wasn't like that. But yeah, my another member of my family also. There was three of us that went at the same time, so the whole family is double vaxxed, which is awesome. And he was feeling a little off as well, and I didn't have that the first time, so
Okay.
maybe it's just more vaccine, but honestly, super mild compared to what would happen if you actually got COVID and if you got one of the variants. So very really can't stress enough how important it is to people to get their first and their second shot. And it's interesting to see from Peel region, and I'm going to look at the numbers in Halton, but every single one, 100% of the people in hospital were people that were
Yeah.
not vaccinated. So that tells you that the vaccine will help keep you out of hospital. It will help to minimize the symptoms should you contract COVID, and that's what it's there for. So
Cool.
get the shot,
My,
people. Get
yeah.
it.
My
Get the
son
shot.
got the shot on Friday. I took him, so and he's a rock star. He got it. He's all ready for school, so
Good stuff.
yeah, he's fully vaxxed. So,
Awesome.
all right. So the earliest step three can open is next week. So it's 21 days after, right? So
Yeah.
really, there's no step four other than fully open. When do you think we'll be fully open?
So that's a good question. I hope step three doesn't continue. I think that as we see the vaccines going up, I think that certainly for the foreseeable future, and we've talked a little bit about this before, that it will be necessary to continue to wear masks and physically distance. And those two measures were so effective and helpful, especially in Halton for people that followed them, because even before we had vaccinations, we were still, lower infection rates than people around us. And so it's going to continue to be really important for people to wear a mask and physically distance, even as we start to see the vaccination rates go up. So I'm hoping we stay open. Let's stay open, let's learn to live with COVID. That is the message that we're getting from health experts. They are no longer talking about COVID zero. They are talking about how to manage and live and function as a society, being open, knowing that this virus is out there. And the number one thing that we can do first and foremost is to get vaccinated.
Sure.
So our regional medical officer of health has said that until we reach about 90% of people with first and second dose, we haven't achieved herd immunity. And that was really the first time that anyone had quantified where we need to get. We are at just over 80% province-wide and in Halton, and just over 65% in Halton for second dose. So we still have a ways to go. There are walk-in clinics that are open. There are lots of options, over 100 pharmacies. There are primary care centers. There are many ways with, probably for most people within walking distance of where they live, that they
Sure.
can get their first and second. So don't delay. This, your choice out there, folks, to get vaccinated will help us stay open, avoid future restrictions, avoid a devastating fourth wave, and keep people out of hospital. That is what it's all about. So let's all do our part and get shot.
Awesome. InSaga did a poll and asked whether or not they're in favor of vaccine passports. A whopping like 3,000 people voted, and 72% were in favor of a vaccine passport from businesses, not for travel, more for businesses and stuff like that. What are your thoughts on that?
So at the City of Burlington, we have decided that we will not be asking for proof of vaccination to participate in city programs.
Yep.
That being said, we do have other measures that we will continue to employ. So we will be requiring masks in certain circumstances. Our mask bylaw is on the books, as you know, till the end of December, unless we lift it or extend it. Our physical distance bylaw, so staying, 2 meters away from anybody that you don't live with, is still on the books till the end of the year. So, and those are also provincial. The mask bylaw, of course, is also at the provincial level. That hasn't been lifted. And there's also a regional one. So there's all 3 levels of government have said that this will continue to be important. At city programs, we also do screening, and we've done that for some time. So we ask folks coming in if they have certain symptoms, if they've been asked to self-isolate, if they've traveled outside the country or come into contact with somebody that they can reasonably know or expect was a carrier of COVID. If your COVID app alert went off, any of those things, we would ask folks not to attend a program that day. And I have to fill that form out every time I go into City Hall myself too. And
Okay.
that's been there for months. And so the benefit of that is it also gives us contact information. If there is an outbreak, we can reach people. So that testing and tracing is still important. So, and I know a number of businesses have been doing that contact tracing. I had beer with a friend, a colleague at a pub the other day, and they took my name and phone number in case there's an outbreak. That's totally fine.
True.
Right? So there are other ways to try to ensure that people are making the right choice to stay home if they're sick, to contact people if there is an outbreak. So those measures have been in place for months and months and months in Burlington and many other places.
Do you hope that the Ontario government actually, brings out a vaccine passport, or are you in favor of that or against it?
So I'm going to rely on what our medical experts are telling us, and at the moment our regional medical officer of health has not, said that there should be a proof of vaccine.
Okay.
And in schools, and this is an interesting point, where you are required to show proof of immunization, and that's been around for decades and decades. That's a provincial directive that we implement on behalf of the province. And those decisions really should be made at that level and at that table, so they are consistent and should be clear and should be informed by what the health experts are telling us. All of that being said, I don't understand why people wouldn't do it. And if there is vaccine hesitancy, you're not sure if the vaccine is safe for you, please, answers to those questions are out there. Get those answers. Talk to your family doctor who knows your medical history. We have an individual in our family circle who is immunocompromised, so I got those answers. It's okay to have questions. It's okay to wonder about, is this safe for me? But the answers are out there, and the bottom line is, yes, it is safe, but don't rely on what your friend on Facebook tells you. Please talk directly to the medical experts. Please get that information directly to to your circumstance, and it should, once you get that information, I'm quite convinced that you'll see that the vaccines are safe and they're healthy for you and for your loved ones, and it will help us. The more of you out there who get the vaccine, it will help us to stay open, which is what we want. We want to be able to continue to see our loved ones. We want to be able to continue to have businesses open. People want to go to work. We don't want to see a return to those restrictions, and we need that 90% herd immunity vaccines before that's going to be effective, according to our regional medical officer of health. So take it from the medical experts that this
Yeah.
is really important.
Don't take it from Facebook or Twitter MD.
Please don't. Credible sources only,
Yeah,
people,
of course.
and
So
ask your questions because the answers are out there.
perfect. How's the vaccination rollout? Well, I guess it's more of a rollout now, but I mean, like, it going in Burlington.
It's going great throughout Halton region. So we just had the announcement late last night, early this morning on halton.ca that there will, because there's now so much supply in so many different locations, which is great. You can get it at 100 pharmacies in Halton. You can get it at your primary care center. Many family docs and other places are offering the vaccine. So Halton region will be closing the clinics at Oakville Trafalgar Hospital as well as Joseph Brant Hospital as of the end of day business of August 16th, because there's all these other options for people, and there are a number of walk-in clinics available. So no appointment necessary, just show up when it's convenient to you. In Burlington, the walk-in is at Gary Allen Learning Center, which is on New Street. It's on a bus line. It's quite convenient, but there are, I believe it's 6 others, or 6 in total, including Gary Allen, throughout Halton region. And as a Halton resident, you can go to any one of them. So whatever is most convenient to you. If you live in North Burlington, it might be easier for you to go to Milton or Oakville. That's fine. There are walk-in clinics there. So please check it out on halton.ca. You will see the list of primary care providers that have the vaccine. You will see the list of pharmacies that have it, and you will see the walk-in clinics, as well as some of the standalone clinics, which will be continuing. But the 2 hospital clinics will be standing down and returning to hospital care, which is what we want them to do.
Yeah, even for my son, it was very seamless. Literally booked it on Thursday, was in there at 4:55 on Friday. Boom,
Yep.
we just walked
Yep.
in. It was great. So I'm sure it's like that in Halton as well. So Toronto's daily vaccine rate has slowed down considerably. And now they're going kind of door to door, going into more of the neighborhoods that the uptake's really low. Does Burlington have any strategies to get to that final 20% or 10% if we get to 90, right, to get them jabbed?
So these are decisions, of course, that are made by Halton Region, the medical officer of health at the region, that would apply to all municipalities. So the region has said that as part of standing down the 2 clinics, they have throughout offered pop-up clinics. So they've done pop-up clinics at places of work, at long-term care facilities. They have gone into some of those neighborhoods, and that's one of the reasons why they want to close the 2 hospital clinics, because then they can focus on penetrating those neighborhoods or areas or places of work where the uptake has been a little lower for whatever reason. It could be partly hesitancy, it could be concerns about transportation, it could be I couldn't figure out how to work my computer to book an appointment. There could be a number of reasons why folks in certain areas have not gotten vaccinated. So this will allow much more targeted approach, and that is exactly what they're planning to do.
Okay. This weekend is obviously a long weekend. We all know this. Is there any extra enforcement going on, or is it a kind of a free-for-all now?
Oh, we have enforcement, and please, the first thing that I will say is fireworks are not allowed. Okay. Please do not buy them. You can't actually buy fireworks in Burlington except for 6 days in advance of 2 holidays. Canada Day and Victoria Day, which have passed. Those are the only 2 days in the calendar year when you can set off personal private fireworks in your backyard. For anything else, including a park, you need a permit, and that you can get from the fire department. So please do not discharge. If you have an extra leftover from the last time you were at the fireworks store, don't set them off. It disturbs pets, it disturbs people to have random booming and cracking and popping going off, and it's also a fire hazard potentially. So,
and also the amount of cops get called for that.
Well, it's not a great use of resources to have to chase
Yeah.
this down. And it's very difficult, as you know, to isolate and find out where it's coming from. By the time the call goes in and somebody can attend, the fireworks display is done. And, I can hear it going off around me on some of those holidays, but I don't know what neighborhood or what property or where it's coming from. So it's really hard to enforce.
Oh no, I was talking to the Peel police, and they were saying that a lot of calls come in saying that they heard gunshots, right?
Oh my goodness. Oh
Right.
my
So I'm
goodness.
but they're not. They're fireworks, right?
Oh, so are they saying it's gunshots so the police will respond, or they actually truly think that the fireworks
They
sound
think
like
it is. They think it
gunshots?
is.
Yeah,
They think it is, right? I mean,
yeah,
because they
that's
sound
what it sounds
similar. Who
like.
knows, right? So, anyways, yeah. So
So
just don't. What? No
so
fireworks.
please, no fireworks, please. Uh, don't make us lobby for a province-wide ban on fireworks. This has come up in my conversations with mayors across the province, that this is an issue in every municipality, and there's an increasing lack of tolerance from individuals to have to be subjected to random fireworks at all times of the day and hour and outside of those permitted times. So we have tried to strike a balance to say when you can do it. And if it's a larger display with more potentially hazardous fireworks, you do need a permit. You need somebody that will help you with that. So we've tried to provide some allowance for it, but also contain it because, and many people have said that in climate change, why are we even doing fireworks at all? And it's about that's another yet another valid point. So restricted and limited and within reason. And so really, I'm saying to folks out there, don't make me join with my fellow mayors to ask for a province-wide ban on this. And that's how some municipalities and provinces are going.
Interesting.
Because when the goodwill bank account is depleted and people don't play by the rules and be respectful of other people, then stronger. Don't make me do that. The other thing
Still
you
there?
asked about, uh,
Think about.
I am still here. What just happened there?
I don't know. I got you back. I got
Is
you
it
back.
is it
So
laggy?
it's lagging. It's weird.
Yeah.
Okay, but I got you.
You know what?
So
Let me see. I might be on Wi-Fi, and there may be lots of people.
okay. Did you say a lot of people are using it?
Okay, I'm back.
All right. So, and is there going
Anyway,
to be
so let's
any
just
more
keep
enforcement?
going then.
Yeah. Is there going to be any more enforcement otherwise in regards to like the bylaw, like social
So
distancing and all
we
that stuff?
our staff are out regularly patrolling, and
Okay.
we've talked about, where it tends to bubble up is in our parks and public spaces, obviously, right? And so we had some challenges early on when parks were open, the weather was nice, and bars and restaurants and so many other things were closed, so everybody was in our parks. But now that more things are open and people can, instead of grabbing takeout and going to the park, they can actually sit on a patio or sit inside a restaurant. We've seen the numbers at a much more manageable level. The fact that the stay-at-home order was lifted, people are now able to travel for holidays. So we're starting to see a return now to much more manageable numbers in our parks because of all those reasons. That being said, we do know that there are some hot spots in the city that have been there forever and ever, where people want to push the envelope of what's permitted. So our beach strip, just as a reminder, is closed. All our parks are closed at 11 p.m. So if your car is there after 11, you will get a ticket. And we do get those weekly updates on how many tickets have been issued. You cannot park on the gas line, and we've issued a bunch of tickets for that as well. And just a reminder that it is paid parking Saturdays and Sundays, not holiday Mondays, but it is paid parking 8 to 8 on Fridays and Saturdays. If you are a Halton resident, you can fill out an exemption form for free parking or get one from the attendant. So we do have people stationed in that park as well as other parks. It's going really, really well since since some of the earlier sort of gong show situations was led to all of this. And we do have police officers there every weekend to make sure that there are not a small gathering doesn't turn into a 1,000-person party with fireworks. So
Cool.
they've been able to already disperse crowds that were starting to build. In one case, it was 400 people that were down there, and they dispersed that.
Right.
So we have zero tolerance on that. Enjoy our parks responsibly, but don't gather, don't set off fireworks, don't have fires. That's not permitted on the beach either. And keep your beverages at home, please. Your alcoholic beverages. We haven't yet gone down the path of allowing alcohol in parks. I know some people are interested in that. If we could do it responsibly, it's not a bad idea, but that's the key word, is responsible. So let's see how we do with some of these other things. Yeah, not yet.
All right. So I sometimes I have to ask you a question that's not your jurisdiction, but we get asked this a lot. The back to school plan, or the lack thereof a back to school plan. I know the mayors are a direct line to the province. So I mean, what are your thoughts on this? We're literally 2 weeks away. There's no plan.
So I strongly encourage, the mail carrier must be here.
Okay.
Protective dog is on duty here. Please talk to your school board, talk to your elected trustees. If you have concerns, find out what the real plan is. So we do have, as you know, my COVID-19 task force, and we do have representatives from the school board on that call. So they are looking at quadmesters, which is what they did prior. They do have measures in place. So please connect if you have any questions. Don't get your information from your friend on Facebook. Talk straight to the school board. Talk to your trustee if you have concerns and you want to advocate for something. And if the school board starts to advocate for something based on the work they've done, then we would certainly be more than willing to help and participate and add our voices to that. We would want them to lead because it's their area of expertise and jurisdiction. Okay.
Here's a reporter question. Last week, the city announced that they are expanding their oh no, this is wrong question. I'm sorry. That's the next question. This week, you addressed concerns over the high rises proposed at the former Holland Park site. Why is council unable to impose a height restriction?
Because there is no height restriction in our official plan.
Okay.
And there's no height restriction in our zoning. And so what is being proposed is legal, and we have no legal grounds to stop somebody from doing something that is legally permitted in our plans. So we in our new official plan and the work that we did, starting really in my last term of council, to start to sketch out what growth and development would look like around our 3 GO stations. And of course, this site is within that Burlington GO station boundaries of major transit station area. We know from provincial policy and our own policy that that is where height and density should go. Now, how much height, how much density? Of course, we can have a conversation about that and manage what is the right proportion. But there's no question that these areas have been envisioned for some time to take height and density. As we were doing that work, we looked to, can we impose some conditions or height restrictions in this area? And so what we were able to do, and what is in our new official plan, is that within 10 meters of Fairview and Drury, which is right where this property is, and it extends elsewhere as well, but we're just talking about this piece of property. So within 10 meters of Fairview and Drury, we have said the limit should be 6 stories. It can step back and then go higher, and there's no height limit, but right at the street facing level, we try to control for what the pedestrian experience is going to be on the street, and not have this like wall of of towers. So we did implement that in our new official plan. And the other tools that we have to control height and density, if you will, is through things like our tall building design guidelines. So there's a restriction on the floor plate, which is the how much space that tower column would take up. It's 750 meters. So we have small kind of point towers as opposed to these massive hulking things. That's one measure that we look at. Our staff do look at shadow impacts. If those are unacceptable, we can adjust height because of that. And so each application would be weighed and assessed against a whole range of technical criteria that may end up saying, you need to adjust the height on this for these following technical reasons. But as of right, they have the ability to apply for whatever height, and then we evaluate against those criteria. So that work is currently underway. But yes, we at council and city cannot turn down this application just on the basis of height. What they're proposing is legal.
Okay. Everybody saw the video of that tiny dog protecting that girl from a coyote. I don't know. Did you see that?
I don't know that I did, but
no. In Toronto.
Yeah.
Yeah, a little tiny dog protected a girl that was walking.
Awesome.
And from the coyote. Dog's going to be fine. But anyways, the reason I'm saying this is there a coyote problem in Burlington? And is there anything being done about it, if there is?
So yes, we have had coyotes living with us in urban areas for quite some time, and we've taken a number of steps. So actually, somebody recently sent me an article, I believe it was in the Globe and Mail, from an expert in these matters, saying here are the steps that should be taken to manage coyote issues, all of which I'm happy to report the city is already doing. So these are the kinds of things that we can do. Well, let's start with what we can't do. We can't just go and kill all the coyotes, okay? Yeah. And so we wouldn't want to do that. But even if that was something that was being contemplated, all that does is free up territory for more coyotes to move in. So you're in this endless cycle. And so you have to address, why are the coyotes there in the first place? And coyotes will go where there's a food source, clearly. And so we really do ask residents not to leave food out. Be really careful with bird feeders, because they can sometimes land, when birds are eating and whatnot. The location of your feeder, it can land on your lawn, and then it's there for any animals. And the coyotes will go after small animals. Right? So if you are attracting squirrels and raccoons and other small animals to your property, you are also attracting a coyote who feeds on those animals. So it's really important to understand why the coyotes are there. Some people actually feed them.
That's weird. I heard that too.
They think it's cute. So so we have a bylaw against feeding wildlife. That's already on the books. That was one of the suggested strategies. We do have education around protecting your food sources, around proper storage of green bin to make sure it doesn't get opened, and the latches that the newer green bins, they've been around for a while, have a very strong latch. We don't have a garage. We store our green bin outside, and it doesn't get opened. They can't open it. So that works. Don't put your, anything that has food waste in it. So, if you have garbage wrappers from, something you've purchased and you put that in your regular garbage waste, don't put that out to the curb or keep it in an area that is not accessible by animals. So all of these steps are really important. The other key piece, and this was in the article as well, as not being friendly with coyotes. And I know that sounds counterintuitive, but the city does do hazing, and that is what is recommended. We want the coyotes to feel like they shouldn't be interacting with human beings. We want them to be afraid of us to go walk the other way. It's when coyotes feel like humans are their friends, humans are a source of food, there's no danger here, that then the coyotes become a danger to human beings because they're not afraid of us. So our city staff, animal control, will go out and haze coyotes. They have done that in the past. So in one case, somebody allowed a coyote mom and her pups to exist and live under their back porch.
Wow. Okay.
So the city went out and hazed the coyote to have them move off, right? Which is really difficult when it's denning season because the moms are super protective. So these are all the measures that the city takes. We also have coyote reporting, so we can kind of figure out where they are, and if we get a lot of calls in one area, that may mean there's a pack or some denning going on. We can, our staff will address that. So those are all the steps that are recommended by experts and the ones that the city is following. We have a whole coyote strategy, by the way. I'm just kind of giving you the highlights. It's online. It's been there for a long time. And it is most acute in areas that are near ravines and water sources. So all the things we love to live near, so the coyotes.
Okay.
So South Burlington gets a lot of them. Southeast Burlington, I know the ward counselor there, and he partnered with the Oakville ward counselor on the border of Burloak to host a community meeting. There were, I think, 200-300 people on that call. That was recorded. The questions are there. They had coyote experts. They had experts talking about what our level of jurisdiction is or isn't, what will help, what won't. So again, I've given you the closed notes here, but you can go online to the City of Burlington webpage and find our coyote strategy, find a recording of that meeting. And, so we're aware of it, and we are taking all the steps that have been recommended by the experts in how to essentially coexist, but in a healthy way where each respects the territory. So we don't feed the coyotes. We want you to know that we're not your friends. As humans, and you need to be afraid of us so that you don't come near us and walk and chase us, that when you see us, you run the other way. That is what we want.
Awesome. Mayor, it's been half an hour, but is there anything else you'd like to bring up? Anything?
Well, let me see. We've talked about vaccines, which is good.
Yeah.
You know what? There's also the local love pass here in Burlington, which sounds kinkier than I meant, but it's actually about showing our businesses and services and all the institutions in Burlington some local love. So it's a pass that has been developed by Tourism Burlington. It's on your mobile phone. You can download it, and it will give you lots of discounts. So discounts on restaurants, discounts on admissions to places like the Royal Botanical Gardens, art gallery, museums. It will give you discounts on services. So it's really to encourage people to get out there to support our local businesses. And there's some sweeteners in the pot there for you. So
can anybody buy it?
Anybody can.
Yeah, somebody in Mississauga, somebody in Brampton, somebody from Toronto can buy it.
Anybody can show some local love to our fine restaurants and shops and services and attractions here, and it's free. Okay. So you don't have to buy it. It's totally free. You just go online and you enter your postal code. Now, if there are local love in programs happening in other areas, you might get the offers related to your postal code. But yeah, we get the offers here in Burlington. So I think so. That's a good question, though. Try it out and tell me how it works. Tell me if you can use it.
Okay, I definitely will. It sounds awesome.
I downloaded it yesterday and it was fine, but I'm in the right postal code. So
yeah.
So check it out and give it a try, and we'll talk about it next week. You can tell me what you figure out.
Awesome. Mayor, thank you so much for the 34 minutes today, and I'll catch you next week.
You're very welcome. Okay, take care.
Have a great day.
Bye-bye. Yeah, you too.
Thanks.